Welcome back to episode 2 of MedTech Trailblazers special reprised edition, where we hear Dr. Paul Yock discuss the legacy and impact of his Biodesign program. On a personal level, Paul also shares his thoughts on what comes next for him. Thank you. Well, one element of the Biodesign process that I believe to my core is the needs assessment, the needs, understanding the need. Can you talk through that? Because regardless of the environment, that is a core underpinning of this whole program.
Well, I guess I'd start with the point that there is a lot of great, what I call technology push innovation, where you have a brilliant invention and then you figure out where that gets applied. That's great. That has to continue to go on, both in companies and universities. But especially in our sector of health technology, you can look at the inverse of that. That is to start with the understanding of a need, really go deep on that understanding, and then figure out what mix of technologies can be brought to bear on that need. Mm-hmm. And it works especially well, I think, in health technology for a couple of reasons. One is our landscape of important stakeholders is really complicated. It's not like inventing a consumer technology where you have one customer, and if you understand that customer profile, you're off to the races, right? It would be great if you could just invent for the patient or the patient and physician.
Yep.
But we have this weird system where they're not purchasing the technology, right? The hospital is, or the insurance companies are. Somebody else is regulating the technology, and that's a huge stakeholder, right? And then, we have to be careful of the press. We have business entities. We have physician groups that could block a new innovation. It depends on the government in a heavy way, and all of the stakeholders shift their priorities when something like Obamacare comes up or whatever we're doing now comes up. So it's complicated.
Yeah, your image of a many-headed hydra. I stole that the other day for a presentation with FDA. All right, so next year is Biodesign's 20th anniversary.
Yeah.
What are you most proud of? I think from my perspective, that program has been incredibly influential and will continue to be for decades to come, because you've spawned processes, not just a way of thinking, but the other collaborative programs around the world. So what are you most proud of?
I think I'm easy answer, actually. I'm most proud of the trainees of the program. I mean, we have some just incredibly talented young people. We have 30 CEOs of companies now that came through the program. And on the flip side, a bunch of people on faculties of major universities, both in engineering and medicine, 10 at Stanford alone, and they all understand this process.
Yeah, the methodology.
Yep.
Yeah, and that's what you're most proud of.
Absolutely.
It is that the output of this program is people.
Yeah, hands down.
And I think this does go back to the point that you made a long time ago. Your internship, the impact that had on you. Mm-hmm. It's through people that these things live, right, and grow. And and I think that we're living through a pandemic right now, right? Yeah. It's your version of a pandemic, in the nice way.
Yeah, exactly.
So moving on a little bit, so we touched on what we're calling the traditional biodesign. Mm-hmm. You're using the biodesign method in other areas now, in areas of diversity, equity, quality. Would you like to talk a little bit about that?
Well, I guess that the linkage is, I think the process works well in any situation where there's a really complicated set of stakeholders, and where you really want to slow yourself down before trying to find solutions. Slow yourself down and deeply understand what is the nature of the need. And there's no more complicated scenario, I think, than these issues of diversity and inequity in healthcare, and so we are trying to work with some different groups to look at gender issues, to look at racial issues, to look at health inequity issues in general using this methodology, and explicitly being really careful and methodical about saying what are the most important needs that we need to solve before doing a ready, fire, aim innovation.
Yeah, which is I could not agree more, right? And I think you're talking about numbers of areas that are incredibly complex.
Yeah.
And simple answers, why we would all like to be able to have simple answers,
Yeah.
it can be quite dangerous. So yeah.
And where our instincts don't work.
Yeah.
So
excellent. What's next for Stanford Biodesign? This is a quick layup question for you.
Yeah.
What's next for Biodesign?
I have this partnership with a crazy Australian so one of the things that we haven't done from the university perspective, one of the things that we have not done well is the next step beyond a good invention. We're good at characterizing needs, we're good at getting to an invention of some sort, and then we've said, good luck, go make it happen. When we started 20 years ago, there was enough money in the system, and the valley could absorb a good idea and make something out of it.
Give it enough time.
Exactly right.
Yeah.
Not true anymore.
Yeah.
So I think we need to put additional resources into that important next stage, preparing people, really shaping up that project so that it is business ready, that it can attract some funding, and getting a team together that has the ability to take it forward. So that's an important next step. And our partnership with Fogarty Innovation is, I'm just delighted to that is the missing piece. I mean, it's nice to have, prototyping space and so on. That's great. The important piece is the expertise.
I was going to say, it gets back to the people again, right?
Exactly.
Right. Yeah. Everything in my career comes back to team, to people. Yeah. Yep. So thank you. And that was a definite layup for that question. All right. So we all know that health technology innovation is tough. We spoke about the many-headed hydra before. In fact, you've been known to say cool inventions aren't cool unless they make it into patient care. What are the biggest challenges today that you see?
Mm-hmm. So I guess I'd say two layers of challenge. One is just purely from a business lens, no question, getting enough initial reimbursement for a new technology to get legs to be able to prove itself is the major obstacle. At a higher level, though, I think COVID is making us aware of the fact that we really have a bad inequity situation going on with how we deliver products, health products, to patients. Mm-hmm. And, I think we have to be aware of the fact that a lot of the technology that we invent does go to that upper tier of patients. And so I worry about that.
So I wonder, though, if I totally agree and totally understand, but that's also where the payment is.
Yeah.
And so, this is a structural thing we'd have to have a look at to be able to do that, right? Because you're not going to, there needs to be the incentive, right?
Yeah, you can't invent your way out of that problem.
No, you need to change the system.
Yeah.
Look, the breakthrough technology that FDA's had for a while that now CMS is leveraging, that's going to be very interesting over the coming years to see how that works, and maybe that becomes a pilot. So you touched on COVID, the question earlier than I was coming to, that it'd be remiss of us not to talk about the impact that COVID has had, and I don't mean this year, I mean for the future.
Yeah.
How do you see lasting impact here?
Yeah. Well, I will pick up again on, a silver lining is that it has made us all aware of health inequity, distribution of healthcare in the country. So that's hugely important. There's also, though, I think an interesting amplification of something that was going on anyway, which is a shift to consumer focus in health care and health technology. And now with telehealth, with home visits, we are wholesale looking at the whole enterprise of how healthcare gets delivered. And I think it's going to increase the shift to home-based. How can we do consumer-facing? But that means being able to access healthcare from your home in a more user-friendly, more comfortable, more effective way. And there's a heap of innovation that can happen in that sector.
Yeah, I really hope that folks look for real problems, though, right? So
Yeah.
I think that the drive to treat, that was almost a deliberate misstep in what I was saying. We need to be looking at treating patients in the home, not just monitoring.
Yes.
Right, so the whole concept of looking at our hospital infrastructure and saying, hey, there might be a bit of a flaw there. How do we move therapy? So diagnosis, monitoring, and therapy to home.
Yeah.
I like the original surge of digital health.
Yes.
Right? I think they were targeted in the wrong area. They were consumer-oriented products that really weren't healthcare products.
Yeah.
And so I think it's just going to be interesting.
Yeah.
What do you think about that? Is that?
Well, the other thing it makes me think about is how to put this together. So one of the big levers that consumer technologies have is their ability to influence behavior. I'm
Yes.
thinking about, Facebook and Google and Apple and so on. And here again with COVID, we've seen how incredibly important behavior is to health.
Yep.
I mean, if we could change one thing right now to impact the virus, it would be behavior.
Yeah, mask wearing.
Right.
Yeah.
So that's maybe another direction that comes out of all of this.
Yeah, I think I've heard Peter Fitz talk about this concept, and all your career, all of my career has been treating, quite frankly, chronic disease, late stage disease.
Yeah.
The only way to change that course, honestly, is change behavior.
Yes.
So to be a little bit more preventive.
Yes.
We can't do that with a stent. We can't do that with a mitral valve. We need to be doing it with another tool, and that's where the digital tools can really come in.
Yeah, that's exactly right.
Yeah. Maybe that's, I mean, I know that's why both of our programs are heavily looking into this space. I just want us to be really careful.
Yeah.
Right? There's I don't want it to be the next shiny object.
Right.
We need to think carefully. We need to apply the biodesign method to this.
Yeah.
All right, so to finish up, I've got 4 more questions. A little bit more fun.
Okay.
What's next for you? What's next? What's the next part of your career?
So career-wise, I do genuinely want to focus on this problem of helping people not fall off the cliff. I've got a good invention, but what's next?
Yep.
So I want to put some energy into that. I also pick up another thing we've talked about. I want to continue to work in biodesign. I do want to genuinely work on our diversity. Our field is terrible. I thought as recently as a couple years ago that health tech must be better than regular tech in terms of gender diversity and racial ethnic diversity. Not true. It is, I'd make the case it's more important for us to be diverse in health tech because we're trying to serve those patients, right?
Yeah.
And so why are we not doing it? So I'd like to put some energy into that.
Well, that's a big task, and it's it is the right task that we should be doing.
Yeah,
a noble task. You've been incredibly successful. You've accomplished a tremendous amount. Not just now, right? The folks that you've educated are going to go on for a long time here and propagating. What about you?
Yeah. So, a couple of things. I want to take a little bit of time and do some needs finding in a particular area. I have a general sense that there's a leverage point somewhere in K-12 with respect to underserved students, and I don't understand this area very well, and I don't want to go too far on my instincts, but I want to learn more about what the situation is with respect to those kids and what we might be able to do to leverage that better.
Awesome.
So
let me know how I can help.
Yeah. Well, seriously. We'll see. I think it's an incredibly highly amplified point to focus on.
Yeah, I think what got to me in that was your leverage point, right?
Yeah.
As an opportunity to have a multiplier effect.
Yeah,
early.
Exactly right. Yeah.
Thinking back over your entire career, what would you have done differently? Okay, not going all the way back to philosophy and maybe continuing that because the world's a better place that you didn't choose to do that. What would you have done differently?
I find that hard to answer, actually.
Yeah. That's why I asked.
Yeah. So I think the reason it's hard to answer is that I feel incredibly lucky, career-wise. I am a walking, talking example of right time, right place, along the way. And so I can't, that just was so extraordinary that I can't kind of think about rewriting any of that. I don't.
So a good answer is nothing.
Yeah.
That's okay.
All right. Thank you.
Yeah.
I'll stick with that.
Yeah. Because I think it's true.
Yeah.
Two more.
Fire away.
What's one thing that we don't know about Paul Yock?
Oh, that's another. This is where I'm supposed to yodel or have a llama collection or something like that, right?
What are the folks in your professional sphere?
I have a really boring answer to that, which is I still read a lot of philosophy and religion, and I'm really fascinated by what different people think and believe and why they believe that. So that's kind of a big hobby for me.
Have you got the opportunity to take time at Stanford? I mean, I'm pretty. Do they do philosophy at Stanford?
Oh yeah, absolutely.
Sorry.
No, I do hope that I'm going to downshift a little bit in terms of work hours in what I have been doing. That's exactly the direction I want to go.
Beautiful. That'd be coming full circle.
Yeah.
And I will join you in the pubs to have discussions. You can teach me.
What the guy I told you who gave me the advice not to do philosophy but to go to med school, he said, when you're in your gentle years, then you can come back to philosophy. And so I figure I'm getting there.
You're not in your gentle years yet. All right, finish up. What's one, for the young folks out there, what's one piece of advice you'd give them today?
Yeah, so all of the usual advice is right? Don't sit around, go try it, figure out what you don't know how to do and build a team around that. Don't stop, just keep pushing. All of those are really big things. The one I'd want to add that sort of flows from our discussion is finding a mentor doesn't happen. It's you have to go out and do it, and it is critically important. And you have to shop your mentors, and you want to pick based on experience, of course, but you want to pick somebody where character is on the docket, as they're saying. Pick somebody who's honest, who really is going to look out for you, but has good values, and spend a lot of time shopping to find that mentor.
Yeah, I think that is excellent advice, because we talk about mentorship, we all do, the value of it, but I do feel that sometimes people expect to be mentored.
Yes.
Rather than seeking it out.
Yes, exactly right.
And I think you've got to seek it, and again, character is more than on the docket. Character is it.
Yeah.
So thank you. Really appreciate you taking your time today. Looking forward to doing this many more times into the future.
All right. Sounds good to me.
Particularly as we move into your gentle years with the philosophy. I want to get into that. So thanks, Paul.
You're welcome.
Thanks
Thank you,
everybody.